the timeline for this MACRA quality payment program is all of 2017 is the performance year. If you need to submit all your findings by March 31st, 2018, and they will give feedback on your submissions in 2018. And then the adjustments will start taking place in 2019, January 2019. So the period opens January 1st and closes December 31st of 2019. And CMS in the final rule, they made a transition year. So in this year, physicians will experience a 4% penalty in 2019 if they choose not to report any kind of performance data. So they can avoid payment penalties in 2019 by reporting for one patient on one quality measure and one improvement activity, or the 4 required advancing care information measures in 2017. And those physicians that are interested in qualifying for a positive payment adjustment, they must report more than the minimum of one patient for one quality measure, improvement activity, or the 4 required ACI measures. So there were some changes in the final rule. There was a little more support for small and independent practices. There were new opportunities that they came out with for the advanced alternative payment models. They gave us a more flexible pick-your-own approach and pace for 2017. And all these programs are now unified into one program supporting clinician-driven quality improvement. So for small practices, small independent practices can be excluded from the new requirements if their Medicare volume is less or equal to $30,000 or less than or equal to seeing 100 Medicare patients. So let's get into a little bit about what an advanced alternative payment model is. So what this is they're like a shared savings program or demonstrations where clinicians accept both risk and reward for providing coordinated, high quality, and efficient care. There's certain criteria that the advanced payment models meet and need to meet for being in an advanced model. And one thing to note is in the final rule, they did note that for advanced payment models, you won't be able to know if you actually reached and exceeded the goals that were met until 2018. So our recommendation is that all providers, even if they're in an advanced payment model, are involved in doing the MIPS program as well. That way, you're covering yourself and you're doing the MIPS program in case for some reason the APM that you're in does not qualify or was unable to report the requirements for CMS. Because again, you won't be able to find that information out until 2018 when the information has been submitted. If you are on the APM Path, you earn a 5% incentive program, or I'm sorry, incentive payment in 2019 if you receive 25% of Medicare payments, and if you see 20% of your Medicare patients through an advanced APM in 2017. So we'll talk a little bit about MIPS. So the MIPS-based incentive payment system, it combines the existing Medicare meaningful use, the PQRS, and the value-based modifier programs into one program, with 2017 being the performance year. MIPS payment adjustments are also applied to Medicare Part B payments 2 years after the performance year. So in 2019 is when you'll begin seeing your payment adjustments take place. And then MIPS has 4 categories of eligible provider performance, which contributes to a full score of 100 points. So a little bit more about MIPS. For 2017, the final rule showed that the performance period on what you're able to submit has been shortened. So it was originally for the whole year. You can pick your pace and you can report for 90 days, 90 continuous days, and or you can submit for a full year. So the 2017 transition year with a 90-day reporting period is a large reduction from the full calendar year that was in the proposed rule. CMS also, they raised the low volume threshold in the proposed rule to exempt physicians from all performance reporting to $30,000. Again, the proposed rule called for a threshold of $10,000 in annual Medicare revenue and less than 100 Medicare patients. They also expanded what non-patient facing physicians and individual clinicians that bill 100 or fewer patients with face-to-face encounters. They also actually increased and expanded that definition as well. So they previously proposed a non-patient facing clinician as an individual that bills 25 or fewer patient facing encounters. So the quality portion of the MIPS program, physicians are required to report 6 measures or a specialty measure set, one of which must be an outcome measure, or if there's no outcome measures that are available, then a high priority measure. So those that are in the quality payment program are physicians, physician's assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthesists. If you bill more than $30,000 a year and you provide care for more than 100 patients a year, you are in the MIPS program. Now, if 2017 is your first year participating in Medicare, then you're not on the MIPS track of the quality payment program at this time. So those that are exempt, again, are those that are seeing less than $30,000 worth of Medicare patients a year, less than 100 patients, if you're in a qualifying APM, if you're in a partially qualified APM participant, or that you don't meet that low volume threshold. So to pick your PACE program, we discussed that you have 4 areas and you can pick your PACE. 1, you can not participate and you'll automatically receive that 4% payment adjustment, and that's a negative 4% if you don't submit anything. If you submit something, that 1 patient, 1 measure, and the different areas, you'll receive a 0% payment adjustment. If you submit a partial year, 90 days consecutive, you can go for a positive payment adjustment. And then again, if you submit a full year, you're able also to achieve a positive payment adjustment. You can choose how you want to participate based on the practice size, your specialty, location, and your patient population. So the impact over time for the MIPS program, again, the performance year begins in 2017. You get a plus 4% incentive and a minus 4% penalty depending on what you submit. The performance year 2018, those adjustments will be paid out in 2020, and it goes up to 5% in 2021, or I'm sorry, 2019. Those adjustments will be seen in 2021, and those go up to a plus or negative 7%. And then in 2020, again, those will be seen in 2022 with a plus or negative 9%. There is also a bonus that CMS has informed us of, and that's they have $500 million a year to give away to those practices and providers that are going above and beyond the minimum thresholds that they have set. So if you were planning and you've been on that meaningful use and PQRS track and mindset of a full year for this year, it may behoove you to go ahead and continue that pace and submit for a full year next year in order to have the possibility of getting some of that bonus that they're going to be giving out over the next 6 years. For the 90 days, again, if you go above and beyond like the defined 6 measures and you want to go higher, if you're already doing it and you're already in that mindset, I would continue doing that, and you may have the chance to get a lot of that bonus money as well. So again, CMS sets a threshold performance score each year based on all the eligible provider scores from the prior period. So each year these thresholds will begin to go up, and you'll see changes in those different areas, such as let's say in 2017 you're reporting on a measure successfully on 50% of your patients. In 2018, that measure may go up to like 60% of your patients. So it will increase depending on all different eligible providers and what they've submitted over time. Scores that are exactly equal to the performance threshold will equal a zero payment adjustment. So if the threshold's 50 and you're just at 50, you're not going to get anything for that. You definitely want to go above and beyond the threshold that they set. And then those that are progressively above the threshold, you'll see that you have a chance to get progressively increasing incentives based on what you're submitting. And then if you're going below the performance thresholds, you'll see that those penalties will also increase over time. So one of the big changes this year was the cost category or resource use. That category for 2017 is actually not being not part of the equation anymore for 2017, and will begin again in 2018. The ACI, or Advancing Care Information, which was formerly meaningful use, is now worth 25 points. Your clinical practice improvement activities are now worth 15 points. And you can see that they got rid of cost, but they increased quality, which is now at 60 points. So those PQRS measures and your value-based modifiers, those are now really, really important. And you really want to make sure you're concentrating on those quality measures to ensure that you're getting a better chance of receiving an even greater incentive. So an example of a quality point would be like if a PQRS measure has a 62% measure rate, better than the 60% of your peers, then you can see that it would earn 7 out of the 10 possible points. And this is just an example of how they are going to start looking at your PQRS measures and how they're going to be divvying up the points within those measures. This is just an example. CMS, again, they've come out with that new payment program website. And on this website, you can see that you have different areas where you can go. So you have an area for your quality measures, you have an area for your advancing care information, and then another area for your improvement activities. And in each of these areas, you can see that they have a grid where you can start kind of searching for different things and selecting different areas that are relevant to you and your practice. So they have filters on here where you can search for, all measures. You can search for high priority measures or low priority measures, medium measures. And then they also have a new specialty measure set area where you can just drill down to your specific specialty. Now, if you're a practice, again, that's already doing some of the other things that maybe don't fall into your specialty, you can still kind of select those different quality measures and different kind of measures that you're already used to working on, and then you can download those measures from this website into kind of like a spreadsheet so that you can keep track of different things as well. So it's a really, really nice website, has a lot of different tools and a lot of different things that you guys can use to help you through this process. So things that you can do right now to start preparing for January 2017 is to definitely go out and educate your organization, your leaders in your organization, your provider leaders or directors. Everyone in your organization really needs to be educated on how important quality is becoming to both them and to your patients. So really educate, educate, educate. Estimate your MIPS scoring, and you can do that by using your current meaningful use and PQRS scores and kind of see where you stand on different measures that you're already submitting now. If you're only at that 50%, see what you can do and look at your workflows and things like that to see how you can enhance different opportunities so that your providers and staff can meet those measures. You can optimize your meaningful use in PQRS quality to maximize your MIPS score. So again, if you're doing really well in certain measures and like above 90 or, 95%, you definitely want to make sure you continue to focus on those things that you are doing well in and not let those go down while you're working on other measures as well. Take time to evaluate your staff, the resources you have available, and the structure of your organization. Maybe somebody is doing something now that really can be put on to somebody else, and they can concentrate more on quality, concentrate more on training, concentrate more on looking into the different measures and quality improvement activities that are available so that they can help the organization go through this change. And identify all the deadlines that are impacting 2017. So we all know that the ACO deadline to sign up for an ACO, for a Medicare Shared Savings Program, those kind of items have already passed. So if you wanted to sign up for an advanced care model or anything like that, you'll have to wait till 2017 when those are available again for 2018. So now I'm going to turn it over to Jonathan, and he's going to go ahead and wrap us up on another part.
Thanks so much, Christina. So MACRA is a very complex program. Christina has consolidated about 2,000 pages into 21 minutes. But where we need to focus is taking all of the information, which Christina has provided in an overview, and also what we're being asked by our clients is how do we make sure that our practice has the appropriate tools, has the processes in place so that we can avoid penalties, and how do we maximize the reimbursements that are out there, the money that CMS has currently put aside for the first year, and bonuses. Now, I see some of our clients are on this webinar. Most of you probably know that we understand what's at stake here because we have to use the same tools I'm talking about because we own 4 clinics as well. So these clinics are 100% full risk medical centers. So that means they're risk-based contracts, and we are responsible for every single dollar that is spent on patient care. So when we start talking about value-based medicine, this isn't something that that is just touted around by vendors for the last year and a half. This is something that CareOptimize has to put into action in our clinics every single day for over 2,500 covered lives that we support. So the 4 different modules that we have our clients using are listed here in those circles. We have a population health module that goes along with the care management module. We have a coding module and a peer benchmarking, or really a MIPS benchmarking module. And I want to walk through those really quickly so you all can see how we are using them today, because as you can see on the slide, from the left-hand side, there is a lot of information that is coming into the system. Different sources from payers to pharmacies to patient information. And the challenge is with all of these different payment models that you have to sift through, getting this data to be usable is difficult because it needs to be normalized, easy for the patient to see, easy for the physician to grasp and make changes at the point of care. How do you display it at the correct time? How do you get it on dashboards for your staff? And finally, how do you make sure that you're benchmarking the data properly against your peers? So we're going to walk through a couple of these steps, and this will be relevant whether you are part of an accountable care organization, whether you have a Medicare shared savings program, any kind of value-based contracts that you might have, this is going to be relevant to you. So the CareOptimize Population Management module. This is going to bring in clinical, demographic, and administrative factors. This will help you understand which patients are in the most need of addressing. So costs continue to rise, couple it with the shift towards value-based reimbursements. That makes population health management absolutely necessary for a practice who needs to understand who are my highest risk and who are my highest cost patients in real time. So this module we use has already helped some practices collect shared saving bonuses from CMS. The graphic you see at the top shows that 9% of practices that are participating in a Medicare shared savings program using this tool represent 20% of all 20% of all dollars that CMS has already awarded. So 9% of practices using it, but 20% of the dollars that CMS has awarded in bonus payments. So significant results already from the population health tools that we're using. Again, this is set up on an enterprise data warehouse, so it will normalize data overnight for you, whether it's in HL7, CCDAs, text files, notes, claim feeds. It doesn't matter what the format is. We'll take it and normalize it for you. It's reportable the next day, so you can mine it and then make it actionable. So this way you're stratifying your patient population by whatever ways are best for your workflow, and then setting triggers, automatically outreach by text, phone, email, and take action on who is the most expensive patient. The care management module. This will give a practice an easy way to create the routine contact with their care manager. This goes hand in hand with the population health module. Population health module shows you who they are, gives you the actual numbers behind each patient. The care management module gives you the ability to create an automated care plan for each of those patients. They're all evidence-based, and they can be delivered in a matter of seconds to you. We link all of these evidence-based recommendations with every protocol. So you're able to educate the staff or choose to override it if you wish. But of course, you need to be the ones to choose which protocols are best in line with your population. And like all of our analytics modules here, we are bringing data in from multiple sources and putting them on a single location for you. The The value really of these population and care management tools, as you can see here, on average, the 3 top percent of most expensive patients are representing 30% of a practice's cost, and the top 5% are representing half of a patient's cost. So if you're not using any kind of population health tool now, it is a very, very simple way to make sure that you're not that you keep your utilization and your costs in check. Our coding module is uncovering for practices where you're undercoding, missing coding opportunities to make sure you're being reimbursed correctly for unhealthier patient. So whether it's Medicare Advantage or managed Medicaid or any alternative payment model, including commercial contracts, more and more are becoming aligned with risk-adjusted payments. So the most common one we see is practices not annually updating their HCC codes for their patients. And when you do this, you greatly reduce your reimbursements from Medicare. And there is not a way in nearly every system today to be able to see which codes dropped off from the previous year. This coding tool does exactly that. It will tell you which codes have dropped off from the previous year and what dollar amount that would represent, so you can then code them at the point of care. To give you a tangible idea of how some of these have resulted in positive payments, that RAF score, that risk adjustment factor, we had a group who was 25 physicians using this module, the coding module, was able to collect $3.5 million increase in their reimbursement because their RAF scores went up 21% by using this module. The final piece I'd like to talk about is the peer benchmarking module. So as Christina discussed, in regards to MIPS payments and penalties, you're not graded just on passing or failing. Your results of your practice are compared to other practices. So you score higher, you get bonus. If you get outscored by other practices, you get penalized. The peer benchmarking module, and this is important, this is very powerful because it's going to show you daily where you stand with your selected and possibly other measures, if you choose them, against other practices and providers, so that you know every day where do you stand with your MIPS reimbursement, bonuses, or penalties. So this isn't just telling you you can get a 4% or you can get a 5%. This is telling you the actual dollar amounts that are available, and if measures are capped out, or if you should be selecting other measures to increase the chances of you getting a positive payout. This is very powerful. This fully integrates with your EHR. We do all of that for you, and it automates the process for you. So registration process, monitoring and benchmarking, and your attestation for meaningful use, PQRS, and for MIPS as well. Very powerful tool. So we wanted to make sure we offered something to everyone today. I know some of our clients have already taken advantage of this. There is no cost to our State of the Practice report. This report will go through, and in about 30 minutes, it will show you some KPIs that are specific to your practice and providers. We will walk through it with you. Think of it like a free checkup, if you will, of the billing, the scheduling, the AR, the denials of your practice. And these are some of the KPIs that get reported from that report. I would say that the most important piece that we have just added is a MIPS reimbursement calculator. So it's going to show you your dollars, how much do you have to gain and how much do you have to lose each year by your specific dollar amounts. So if you do have an interest in seeing where you stand, we would love for you to reach out to us. So we have both Erica Badgerin and I. Those are our email addresses. You can always reach us there. You can also reach me by phone. I've got my number listed there. And you can also log on to CareOptimize.com. We are unveiling our new website this evening. Or go to ehrutilities.com. We have free resources that we allow everybody to use as well. The next slide shows some additional resources that are always updated from CMS. If you don't have time to jot these websites down, this has been recorded, and we will be putting this webinar on our Insights page on CareOptimize.com. So later tonight, you can go there and you can check out some of these other resources. Finally, a couple more pieces. If you do have any questions, again, these will be listed on our website as well. Finally, today, we appreciate everybody staying around. I know we've gone a few minutes over, but we will have folks from CareOptimize at two pretty large events coming up. The first is the National NGMA. That's in San Francisco in just a few weeks. So if you are attending, please reach out to us and let us know. We would love to meet with you face-to-face to talk to you more about MIPS and about some of our tools that we have available. And finally, we will be at the Next Gen User Group meeting coming up in a few weeks in Las Vegas. So thank you all very much for joining. And again, check out www.careoptimize.com for more. Thank you so much.